At the Meridian Health and Wellness, what we're trying to achieve and introduce to the public is a structure-function model. Now, people can ask, well, how's that different? What's involved with that? And actually having the contrast between the disease model, the structure-function model is a good way to have a good understanding of what's involved with this. The FDA actually has two systems whenever a product, a piece of equipment is introduced to help with healthcare, is they either go into a disease track or they go into a structure function track. The disease track is where you are looking at a set of symptoms. The only way that things are actually accepted along the disease track care is if you are actually using pharmaceuticals or surgical intervention. Pharmaceuticals are basically have to have a side effects, disease that it actually creates, because they are based on poisons. Now, those can be extremely helpful because they have a very strong acting effect, and what they do is they make the body shift gears so that it is no longer going along a lines where there can be a crisis or a shift. In other words, when the homeostasis is no longer working in the body, then you have to go along with the disease track to get the problem actually taken care of. Whereas with a structure function, it's a health model. Structure function type of care never has anything that is actually utilized that is a problem for people. It doesn't create side effects. It doesn't create issues that are involved on it. And it actually enhances homeostasis. And what we mean by homeostasis is a balance in the body. And when you are talking about balance, that is the definition of health. Dr. Guyton famously stated that that balance is homeostasis, homeostasis is health. The ability of the body to actually shift and to accommodate to outside forces, internal types of changes, where it can actually find that level playing field that it likes to operate. And structurally, there is a balance in the body. That's why we're involved in the chiropractic aspect. That's why we deal with the whole musculoskeletal system, because structure affects function. Function also affects structure. So we're also very interested in the physiology of the body, the electrical conduction of the body, to be able to see everything in a perfect balance in the system, and then we can actually achieve health. So when we were actually talking about to the FDA, and they were giving us information about our office, they said, you are not a disease doctor, you are a health doctor. And that's what we really really look towards. What we're really trying to achieve in our patients is to find out that perfect balance in the system. Along with that, we have something called the 8 Pillars of Perfect Health. That was something that I had designed out, and something that we offer on podcasts, and a good explanation of what's involved with that. And with those, it covers every aspect of the balance of the system and how to achieve that. With that, you can find your perfect health and then never have to get into the whole disease care.